We've seen so much information out there and so much news out there about the tragedy of the opioid crisis. And this is a huge challenge for all of our communities across the country. Chronic pain is a $600 billion problem in this country. Literally millions of Americans suffer every single day from chronic pain. It's not just the pain that is the issue, but it's all the things that pain impacts patients on what they can no longer do in their normal activities in their normal lives. Whether it's taking care of their children, whether it's performing at work, whether it's performing on the field, we know that pain has a very adverse effect on human beings. And one proven legitimate alternative to opioids is chiropractic. In a recent study of over 13,000 subjects, researchers found that when patients receive chiropractic care, the likelihood of them receiving a prescription for opioids was 55% lower. In addition, total drug costs for these patients were 73% lower as well. So it's a great alternative to the opioid crisis. Well, chiropractic can play a great role in pain relief for the populations that we serve. Chiropractic is a discipline focused on the diagnosis, treatment, and prevention of neuromusculoskeletal conditions, and certainly at every level trying to prevent them from occurring in the first place. The great news, as a doctor of chiropractic, every single day we've seen miracles in our office where patients come in, they've had pain, either acute and or chronic, and we're able to get a desirable outcome for them. They get better, patients feel better. But in addition, over the last 20 years, what we've seen is a large amount of research coming out that demonstrates chiropractic's efficacy, cost effectiveness, and certainly high levels of patient satisfaction. Just recently, the American College of Physicians came out with their new clinical practice guideline for the treatment of low back pain in adults. And we all know that clinical practice guidelines are the highest level of scientific evidence. And here's the great news. They came out and stated that for acute, subacute, and chronic low back pain, spinal manipulation is a recommended treatment. So we see that the evidence is now starting to support what chiropractors have been doing for over 100 years. So opioids are certainly not the only options for people who are suffering pain. The interesting thing is that many patients are taking other medications like NSAIDs or acetaminophen. Now, what we know from the science is that nonsteroidal anti-inflammatory drugs come with a risk. In fact, over 16,000 deaths occur every single year from GI bleeds due to nonsteroidal anti-inflammatory drugs. In addition, the FDA came out recently and said NSAIDs cause an increased risk of heart attack and stroke in patients. Acetaminophen is also commonly used as a treatment for patients who have pain. Again, the interesting fact is that in a recent study looking at patients with low back pain, acetaminophen had no positive impact whatsoever. So what options, what evidence-based proven options are available for these patients who suffer in pain? We have absolutely done a lot of clinical research in our Clinical Research Foundation on the impact that BioFreeze has on our patient population. The interesting thing is that we compared BioFreeze to ice, and ice is a commonly used modality for patients all across this country, all across the world. But here's what we found. We found that patients had a 2 times greater reduction in pain by the use of BioFreeze compared to ice. In addition, they preferred using the BioFreeze 8-to-1 compared to the ice. And also in an excellent randomized controlled clinical trial that incorporated BioFreeze plus manipulation, those patients had a 67% greater reduction in pain compared to the manipulation group alone. So it's a great evidence-based, highly researched alternative that can help patients in pain. So it's so interesting that Americans don't understand the options like the use of topicals like BioFreeze, which again is a proven treatment for relieving pain. If you think about this in the total context of our country, we are hijacked by the pharmaceutical companies. We are constantly being bombarded every single day by television ad and radio ad about this medication or that medication, that the norm seems to be the use of medication, popping a pill, is the answer to people's pain. I think healthcare providers have a social responsibility to deliver education to the rest of the healthcare community and to patients and the community at large to help them understand the evidence-based opportunities and tools that we can use, like BioFreeze, like chiropractic, that can provide the appropriate pain relief treatments that our patients and our communities deserve. These are evidence-based alternatives that work, that come with all the benefits and none of the side effects.